I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Most of us have been told to cut back on sugar if we want to avoid cavities, but is there more to a good dental diet? This is the People's Pharmacy with Terry and Joe Graydon.
People don't often connect the state of their mouth to problems like heart disease, diabetes, or other systemic conditions. And yet the oral microbiome can have a profound impact on overall health.
Why is vitamin K2 so important for our teeth and jaws? What foods provide this essential and little appreciated nutrient?
If you've been putting off a visit to the dentist during the pandemic, what should you do?
Coming up on the People's Pharmacy, find out about the link between your mouth and your health.
In the People's Pharmacy Health Headlines, Christmas was about 3 weeks ago, and now hospitals around the country are seeing the consequences of family gatherings. From small rural facilities to giant urban hospitals in Southern California or Arizona, intensive care units are full and staff are exhausted. Earlier in the pandemic, small or remote healthcare organizations would send their sickest patients to tertiary care hospitals when they couldn't handle them in-house. That's no longer an option in most places. The referral hospitals just don't have room or healthcare workers to accommodate additional patients from outside the community. In some cities, such as Los Angeles, there are big hospitals that don't have capacity for community COVID-19 cases. Although the COVID-19 vaccination program is beginning to gather momentum, infections are spreading more quickly than ever.
People without symptoms help account for the rapid spread of COVID-19 infections. Analysis of mathematical models using data collected from different communities reveals that more than half of all cases were passed along by people who were infected but asymptomatic. According to the authors of this study in JAMA Network Open, effective control of spread will require reducing the risk of transmission from people with infection who do not have symptoms. That will mean rigorous application of masks, hand washing, social distancing, and strategic testing, including people who are not ill.
With only about 1 year of experience with SARS-CoV-2 and its resulting infection, COVID-19, we don't yet know very much about long-term consequences. A new study of patients in Wuhan, the Chinese city hit earliest in the pandemic, is sobering. The research, published in The Lancet, followed up on more than 1,700 individuals discharged from hospitals between January and May of last year. All had been hospitalized with COVID-19. Approximately 6 months after hospital discharge, more than 60% reported fatigue or muscle weakness. About a quarter was still having trouble sleeping, and nearly that many reported anxiety or depression. Those who had been most severely ill when hospitalized were more likely to have breathing problems.
Researchers in France have developed a novel technique for detecting thyroid tumors. The usual diagnostic approach is fine needle biopsy. However, this approach identifies a small proportion of thyroid cancers. Instead, the scientists use ultrasound imaging while the patient sings. Tumors react differently from normal tissue to the vibrations from the vocal cords. They found that a person singing ee at 150 hertz for 1 second provided adequate data for computerized analysis and diagnosis.
The American Cancer Society reported this week that there was a significant decline in cancer deaths from 2017 to 2018. The death rate dropped 2.4%, which beat the previous record of 2.2% from 2016 to 2017. Reductions in lung cancer deaths contributed substantially to the overall improvement. This is attributed to fewer smokers, improved diagnosis, and newer treatments such as immunotherapy. There is concern, however, that the pandemic has potentially delayed cancer diagnosis and interrupted effective treatment programs. As a result, COVID-19 could have long-lasting negative consequences for people with cancer.
Every year, about 1.5 million Americans are diagnosed with diabetes. The great majority of these people have type 2 diabetes, in which the body produces insulin but doesn't respond well to it. Could a specific diet help people overcome this metabolic malfunction? A meta-analysis of 23 randomized clinical trials of low and very low carbohydrate diets found that those who follow such a diet for 6 months may be able to achieve remission of their disease. Data are sparse on whether people are able to maintain these benefits after a year. The authors conclude clinicians might consider short-term low-carb diets for management of type 2 diabetes, while actively monitoring and adjusting diabetes medications as needed. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Dental health has taken a back seat to a lot of other health conditions. During the COVID-19 pandemic, a lot of people are skipping routine dental checkups. But the health of the mouth may be critical for unexpected areas of the body. For example, heart disease has been linked to periodontitis. Type 2 diabetes may also be associated with changes in the microbes that live in our mouths. How does our diet affect the oral microbiome?
Our guest today is Dr. Stephen Lin. He is a board-accredited dentist, TEDx speaker, and author of The Dental Diet, the surprising link between your teeth, real food, and life-changing natural health.
Welcome to the People's Pharmacy, Dr. Stephen Lin.
Thank you so much for having me, Terry.
Dr. Lin, you are called the world's first dental nutritionist. Now, what the heck is a dental nutritionist, and how did you get excited about this field?
Yeah, Joe, it's a funny question, but I kind of found that early in my career, and as I was working in dentistry, that there was a big disconnect between what we put in our mouth and what we find as our output in terms of what we go to the dentist for. And I really found that there's a story behind what we eat and what happens when we go to the dentist. So our tooth decay, our gum disease, and even crooked teeth in kids. And there was a story that really we should be basing our dietary guidelines and how we think about healthy eating around dental health instead of really thinking about it the other way in terms of what food does when it goes into the body, and that our dental health is really one of the most powerful indicators as of our overall health. And I think one of the biggest problems on the planet now is that our kids don't develop straight teeth. And this is an anthropological problem where historically, when we change our food, our dental health changes. And that's kind of really was my ticket in. And I found that there's really a great story behind our teeth, and that we really should be thinking about food as the answer for better dental and overall health as well.
Well, Dr. Lin, I think a lot of people think about the food we eat and how it's related to our health of our teeth. They think, sure, you shouldn't eat candy all day long. Maybe they even realize that potato chips are bad for your teeth because they get stuck on those surfaces and they can cause dental decay, cavities, caries. But it sounds to me as though you're talking about something that goes way beyond cavities. How does our diet affect kids' teeth and whether they need orthodontics or not?
Yeah, well, cavities is actually a part of it. And the sugar conversation is really one that's really fired up in the last few years to show that, that what we're putting in our kids' mouth does affect their dental decay risk. But there are other factors, for example, for tooth decay that we don't consider, and that's the protective factors. So the immune system inside a child's tooth, the osteoimmune system, This is run by the fat-soluble vitamins, vitamin A, D, and K2. Now, we should be thinking that a child that has tooth decay is in nutrient deficiency. And so for a child that has crooked teeth, now we need to remember as well that a 12-year-old that has crooked teeth and needs braces is the same problem as a young adolescent or a young adult that has wisdom teeth impactions, where the jaw doesn't grow properly. And that's the same problem again, where calcium distribution in the body hasn't grown the jaws adequately to fit the teeth. And this is a big problem I feel that we have on the planet, that we've misunderstood this way of eating to grow our jaws and develop straight, healthy dental arches.
Well, there's an area that is so fascinating to me that I'd love to get your perspective on it, and that is what we now call the microbiome. Now, we've heard a lot about the microbiome of the gut. There's been a recognition for a very long time that we have bacteria and fungi and viruses in our digestive tract. And we've begun to hear that, there's a microbiome on the skin, all kinds of bacteria and other kinds of organisms living in some kind of ecological harmony. And we've even heard that there's a microbiome of the lungs and a microbiome of the brain. But very rarely do we talk about the microbiome of the mouth. And you talk a bit about how our mouth is the gatekeeper of our gut, helping this whole microbiome thing stay in proper balance. So could you give us a little more detail of what you mean by the microbiome of the mouth and the gut?
Absolutely, Joe. So this is one of the biggest learning areas for myself, is that in the last 10 years, we've figured out that we live alongside trillions of bacteria, and that includes bacteria in the mouth. And it's really kind of silly, actually, that we've disconnected the mouth from the gut. If you're looking for better gut health, you absolutely should be understanding the mouth and looking to heal your dental health alongside your gut health. Now, think about it this way. Every second, you're swallowing thousands of bacteria. That's every second into your digestive system. So when you have an imbalanced oral microbiome, you're delivering that to your gut microbiome. And the way this forms is very early in life, as a newborn is born into the world. Their first touch with outside bacteria is from the vaginal canal during birth, where the oral microbiome is introduced with bacteria from the mother's reproductive microbiome. And this actually then becomes this conversation between the oral microbiome and the gut microbiome, where they stay the same for a few months, but then they become separate and related species of the human microbiome. And so the oral microbiome is like a protector for the gut microbiome, and it actually has species that will protect against tooth decay, gum disease. And this is really a part of the story of tooth decay that we've forgotten, is that there is a balance, there is an ecological system happening in the mouth, and that when we have tooth decay, it's really a sign that the system is in imbalance, and we could call deficiency as well, and where we've had one species overtake in a way and then cause a disease like tooth decay. So the bug strep mutans that we attribute to tooth decay, it lives in the mouth in health, and so too do many other bugs that we really should be attributing. So having a balanced, ecologically sound oral microbiome is very part of this gut health conversation.
Well, Dr. Lin, in America, we have become, I would say, obsessed with killing germs, because there's this sense that bacteria are bad and fungi and viruses. It's all bad, and we need to sterilize everything. And, we have all kinds of cleansers. We use what we call Clorox. But we also have taken this to the mouth. And so we have mouthwashes. Of course, Listerine has been one of the favorites for a very long time. Kills millions of bacteria on contact. And so there's this idea that if we just swish, enough of this stuff, whether it's in our toothpaste or it's in our mouthwash, that we can have good oral health. And I'm just wondering, what what does all this stuff do to the oral microbiome?
So the answer to that, Joe, and this is a great question, is that we don't know. When you look at the mechanisms and the studies behind the